Mental health care must balance safety and ethical treatment. Today we'll explore restrictive practices, drawing insights from global mental health and psychotherapy, which examines their impact and the importance of task shifting in mental health care. Restrictive practices are interventions that limit a person's movement or freedom in psychiatric settings. While sometimes necessary for safety, they raise ethical and human rights concerns. Let's dive into the key aspects of these practices. Let's examine these critical areas in detail. First, what are restrictive practices? These are interventions used to manage patients who may pose a risk to themselves or others. The goal is to maintain safety, but their use must always be justified and minimized. Now, let's explore types of restrictive interventions. Seclusion, isolating a patient in a controlled environment to prevent harm. Physical restraint, using hands-on techniques or equipment to limit movement. Chemical restraint, administering medication like haloperidol or lorazepam to control agitation. Mechanical restraint, using devices like straps or belts to restrict movement. Environmental restriction, controlling access to certain areas or items to ensure safety. Restrictive practices raise ethical concerns regarding autonomy, dignity, and human rights. Overuse or misuse can lead to psychological harm, distrust, and trauma. It's essential to balance safety with respect for patient rights. Lastly, alternatives and task-shifting approaches. Many countries are shifting towards non-restrictive strategies, such as de-escalation techniques, verbal and behavioral interventions to prevent crises, trauma-informed care, understanding past trauma to improve patient interactions, peer support programs, involving those with lived experiences to support patients, task shifting, training non-specialist workers to provide mental health support in resource-limited settings. Mental health care must evolve to prioritize dignity and ethical treatment. By reducing restrictive practices and embracing alternatives, we create a safer and more humane system. If you found this video helpful, don't forget to like, subscribe, and share it with others. Let's work together to promote ethical mental health care.